Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about what frontline caregivers are seeing at St. Luke's amid the COVID pandemic. I'm here today with Dr. Andrew Slachter, a pulmonologist and critical care physician with St. Luke's. Thank you so much for joining us.
It's my privilege. Thanks for having me.
The U.S. continues to break record highs of new coronavirus cases in a single day, peaking at more than 126,700 cases over the weekend. In the Kansas City area, that number continues to trend upward as well, with a significant increase since mid-October. As we could see an even bigger increase heading into the cooler months and holiday season, we'll be talking about what frontline workers want you to know, promising results of a COVID vaccine trial, and information on the virus's spread. So from someone who's seeing the real toll of this pandemic day in and day out on the front lines, what do you want people at home to know?
Well, for the people at home, I want to share a couple of important messages. I want to share that coronavirus doesn't care where you live, doesn't care if you're in the rural communities or in suburbia. It doesn't care what you do for a living. Coronavirus is here and we can all be potentially at risk. I think while we have the optimism of a vaccine around the corner, that apparently, based on today's news, is very effective and also safe, we need to continue to do the things that we know are important and help save lives. We need to wear a mask. We need to wash our hands. We need to socially distance as best able. And we also need to get a flu shot.
And speaking why we need to get a flu shot, tell me why that's so important right now.
As you know, the winter months are a time when influenza usually shows itself a peak. And we also have a variety of other respiratory illnesses that occur during the winter months. And so what we don't know yet is how bad someone's lungs could be with influenza and coronavirus. And if we have anything that we could do to mitigate the spread or infection of either, I think that we should do anything and everything possible.
Can you explain what we're seeing in the Kansas City area right now as far as community spread?
Well, sure, Lindsay. What we're seeing in Kansas City and the local rural associated communities is no different than what we're seeing throughout the rest of the country, which is that cases are on the rise. Cases are on the rise in the rural areas. They're on the rise in suburbia and even in urban populations as well. We are seeing no sparing of coronavirus in our Kansas City region.
And as you mentioned, this stretches out to the rural areas as well. Can you talk about how we're seeing more people with COVID from those areas, many of whom are very sick?
Well, as St. Luke's being a quaternary referral center, we do take patients from around the region who need our excellent care in a variety of institutions and settings. And so as we're seeing coronavirus spread both throughout the rural and suburban communities, we are seeing an increase in folks that need to be sent here to Kansas City, to St. Luke's on the Plaza or other St. Luke's entities for inpatient management of coronavirus.
And what are you seeing on the front lines at St. Luke's? Are there any trends?
So the trends that we're unfortunately seeing is an increase in cases. Every day for the last week, we have seen an increase in the numbers of patients who will require inpatient services here at St. Luke's in our health system. We've been seeing a consistent number of significant ICU beds. While we're seeing an uptick or an increase in the amount of inpatient needs, I wanted to share, though, that St. Luke's and its entities certainly have the resources to continue to take care of patients in Kansas City and local regions.
Definitely. Well, it's been a long 8 months and there's no telling yet when the pandemic will slow down. How are the frontline caregivers doing? Is there anything that we can do as a community to help or support you?
Well, thanks so much for your caring thoughts. I want to share that I think what's important for anyone and everyone in the community to say thank you to those who are working hard in the healthcare setting is to do your part. I know it's not fun to wear a mask. I know it's also not fun to have to limit the activities that we're all used to doing around this time of year and throughout the entirety of the year. But we need to keep our guard up. With the hope of a vaccine around the corner, we need to continue to hold our diligence both in the healthcare setting and in the community to do our part in curbing and turning the tides of this pandemic.
So important. Well, as you mentioned, this week Pfizer released promising results of its COVID vaccine trial, saying it was found to be 90% effective. What's your reaction to that, and what still needs to happen before it's made available?
So my initial reaction, like everyone else, is that of pure optimism. What we know right now is that the vaccine data that's been released shows that this is a very effective vaccine. 43,000 folks who received the the coronavirus vaccine, only about 96 of those contracted coronavirus, and less than 10 of those were folks who had the actual vaccine and not placebo. So we have some good evidence to suggest that Pfizer has created a very effective vaccine. We still need to wait a month or two, if not a little bit longer, to ensure that we have an effective and safe vaccine. But right now, there are no glaring concerns.
Great. Well, as a pulmonologist, you care for patients with respiratory issues, many of whom are in the ICU or very ill. We've heard a lot about the short-term effects of COVID on the lungs. What about the long-term effects?
So excellent question, and something that we are all waiting still to figure out. We've been only dealing with coronavirus since around February and March of this year, and we don't have a lot of long-term data about what the long-term implications over pulmonary health is. I have seen personally patients who've had either ICU-related illness or even mild disease at home who have come back to the office, who have showed marked improvement in their respiratory health, who no longer need oxygen. But we certainly may see some long-standing abnormal lung function as a consequence of either coronavirus, influenza, or any of the other respiratory viral illnesses that plague us usually during these winter months.
Well, shifting now to a recent survey released by the CDC, more Americans are wearing masks compared to earlier in the pandemic, but the survey found young adults are least likely to follow other recommendations like social distancing and avoiding crowds. What would you like to say about that?
What I would want to share is that I know it's really hard. I know that it's hard to be young and be healthy and to feel as if you're being tied down or held back from the activities that you would otherwise want to do. I think my message is no different than the message you've heard before, which is that overwhelmingly, our young and our healthy Americans are unlikely going to get severe disease. But that doesn't mean it can't happen. It also doesn't mean that you couldn't be the one that spread it to one of your loved ones, to your neighbor, to your grandmother, to your grandfather, to someone who may in fact get very sick as a result. And so I would only want to wish that we would all continue to care about ourselves, to care about our family, and to care about our fellow human.
Well, another new CDC report released just last week found that people are almost twice as likely to test positive if they regularly work in the office compared to those working from home. What advice do you have for people who have an alternate option? And for those that don't, what can they do to better protect themselves?
So the CDC did report a case series of less than 30 patients who did show an increased incidence of coronavirus in those who would commute to work. Certainly in Kansas City, we see less of a commuting population. But what I would extrapolate from that CDC guideline would be, if able to stay at home, please do. If you're an employer and you have the opportunity of asking your staff to do their work remotely, I would suggest it. And for those who have to go into an office setting, I would again champion doing the behaviors that we feel are safe. Washing your hands, wearing a mask, staying home if you have symptoms.
Okay, great. Well, is there anything else that you'd like to add today?
As I have from the beginning of this pandemic, I wanted to reach out and say thank you to all of those who work hard to take care of both coronavirus patients and all of those who are ill during a pandemic and a time of uncertainty. I want to give my most sincere thanks to our ICU teams, our COVID ICU nurses, and our COVID ICU respiratory therapists. I believe they are the true heroes of this pandemic.
Well, thank you so much, Dr. Schlachter, for joining us. If you'd like to find out more about COVID-19, including how to get tested and more, visit stlukeskc.org/COVID-19. You can also stay up to date with all the latest developments on the COVID pandemic and other news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.